Okay, hi. So my name is Emery, and I decided to do my project on mental health issues, and I chose suicide rates in older adults. So I'm going to be looking this way because my notes are here. And sorry for the background, but so I chose, like I said, suicide and mental health issue of suicide in older adults. And the article I chose, which will be in the link, is called Suicide in Older Adults Current Perspectives. And so it's kind of like a narrative article, but it also goes into some of the risk factors of suicide and suicidal death in older adults and some of the treatments. So, for one, it starts talking about how older men and women have the highest rates of suicide in almost all countries, but a lot of the information that we have is centered around young and adolescent suicide rates. But the main risks for suicidal death for older adults are becoming like widower or a widow, having other mental health disorders already, physical illnesses and bereavement, and also some psychiatric disorders, which has the strongest association with suicide when it comes to older adults. So the article basically goes over some of the like I mentioned, those are the main risk factors, but the main focus of it was displaying how research has shown that social support is a primary protective factor. And so having that, you're able to reduce those suicidal rates, but one thing that it talks about is to consider when you're working with older adults as a social worker, like how I said, is the social support, and that there's not enough to just have a counselor because a lot of older adults who have committed suicide have seen their counselor or their psychiatrist a month before committing suicide. So it's not just enough to have their older adult going to a psychiatrist. You have to have that social support and the social network because having a low social network and having a death of someone close to you, like I said, is a huge risk factor for it. And also when it comes to some of the psychiatric disorders and mental disorders, one of the things that was mentioned in the article is that suicides, like not suicide, but older adults um, who commit suicide, that one of the difficulties is like mental illnesses or problem solving and using those problem solving skills. So sometimes, as an older adult, when you have those issues with not knowing how to solve the situation that you're in, that's usually what happens. And that just adds on to the fact that without having a social support or a connection to lean on, then it's harder for older adults. So we're going to go into the intervention, which the main intervention that the article talked about and discussed was having general practitioners taking an active role in assessing older adults for suicidal ideation or risk factors that will lead to suicidal ideation. Just because older adults, I mean, the general practitioners are more likely to be the first primary contact or point of contact for older adults, just due to the fact that older adults attend doctor's appointments more regularly because of the age and because of health reasons versus other practitioners or professionals like psychiatrists and stuff. So you're most likely to see a general practitioner as an adult. So, and it talks about that evidence that should be used for this treatment is the chronic care model developed by Wagner in 1990s, which is adapted to treat older adults with depression disorders and should be used at health consultations when you go and when older adults go see general practitioners. So that was the treatment that should be used. The model should be used at those care consultations when general practitioners are involved with older adults. So that was my article, and I'll put the link up under. Thank you.